Hello, my name is Antonio Gotto. I'm the chair of the Committee on Cardiovascular and Metabolic Diseases. I'd like to take a few minutes to tell you about some of the exciting changes that have occurred recently with our educational initiative. The Committee on Cardiovascular and Metabolic Diseases, abbreviated CCMD, has been providing data-driven, authoritative educational information and activities for more than 11 years. Until recently, the initiative was known as the National Lipid Education Council, abbreviated NLEC. The NLEC's educational material has always been based on the most current clinical trial data and guidelines that pertain to the prevention, the treatment, and the management of cardiovascular disease. We gave a special emphasis to the controlling of lipid levels. However, our focus has evolved to encompass a much more global view of the field of cardiovascular medicine with an emphasis on global risk reduction. Much of our material now goes beyond just lipid lowering and into the broader aspects of cardiovascular and metabolic diseases, as well as highlighting other conditions that affect the vasculature. So our new name more accurately reflects our expanded content and the educational goal of focusing on the subject of global risk reduction. Now, beside changing the name of the overall initiative, we've also changed the names of our award-winning website and of our long-running quarterly newsletter. The website, which was formerly called lipidhealth.org, is now called CCMDweb.org, and the newsletter, which was called the Lipid Management Newsletter, is now called CMD Management. While the names have been changed, you may rest assured that the educational content we offer will remain of high quality and will be first-rate. We'll continue to educate healthcare practitioners on the latest clinical data and practice guidelines and give them information about managing cardiovascular and metabolic diseases with the purpose of modifying or reducing global cardiovascular risk. We'll also continue to offer challenging educational activities through both traditional as well as state-of-the-art educational venues. These will include live interactive meetings, audio conferences, webcasts, newsletters, online CME activities, as well as other avenues to deliver to you useful, to-the-point information. As we've mentioned, the CCMD educational curriculum will focus on global risk. The topics we will continue to report on will include, among others, the following: dyslipidemia, hypertension, acute coronary syndrome, type 2 diabetes, the metabolic syndrome, heart failure, stroke, peripheral arterial disease, and obesity. Ours is an independent initiative guided by a multidisciplinary panel of experts in the fields of cardiology, metabolic and endocrine disorders, nutrition, and primary care. This panel of experts makes up the Education Council and faculty of CCMD. CCMD is sponsored by Thompson Professional Postgraduate Services, abbreviated PPS, located in Secaucus, New Jersey. PPS is accredited by the Accreditation Council for Continuing Medical Education to provide continuing medical education for physicians. We hope you continue to find our content helpful to your practice. We've enjoyed working with you in the past, and we look forward to offering you even more educational resources aimed at preventing, treating, and managing your patients' global risk. Thanks for taking the time to listen today.